The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back to the next episode of the Shift podcast. And as a reminder, the Shift podcast was brought to you by a nurse for nurses. And I think it's really interesting when I speak with my guests, we always talk about shifts in their career, fun things that happen in their career. And our next guest, Dr. Angelo Venditti, has a really, what I thought was a good story when I heard at a conference of how he became a nurse. And then I'm going to ask Angelo along the way, shifts in his career. And then we're going to spend a little bit of time talking about the difference between burnout and wellness. So with that, I'm going to punt it over to Angelo. Angelo, tell the shifties a little bit about you, and then please share the story that I thought was really great about how you got into nursing. So take it away, Angelo.
Oh, sure. Well, first, thanks for having me.
You
Uh,
bet.
we're gonna have a lot of fun, I think.
Yes.
I got into nursing a little haphazardly, admittedly. I wanted to be a paramedic, and my dad worked for the state, and so I got to go to college for free at Bloomsburg University. And so I wanted to be a paramedic, which Bloomsburg didn't have. And so I, went talked to my parents and said, I really want to be a paramedic. This is what I want to do. My dad was a police officer and said, look, when you're 58 years old, you're not going to want to be a paramedic. That's not what you're going to want to be doing with your life, but we will support you and help you get through paramedic school if you promise to go be a nurse. And so, the rest is history, as they say. I went to paramedic school. I graduated paramedic school, kept my word, graduated in June, was right in the summer course for nursing school, and went to nursing school. I will tell you, my intention through nursing school was I am doing this to humor my parents. I'm never going to work as a nurse. And I got out of nursing school, got my first nursing job, and uh, I've been a nurse ever since, of course. And so, for those of us who are nurses, it's kind of like what you live by. You identify as a nurse for the rest of your life, even if you're not doing nursing things. Um, so yeah, that's kind of my story.
That's so, Angelo, what was your first nursing job? Did you work in the ED?
Yeah, I worked in the emergency department. This was at a time when many organizations weren't hiring new grads. They were kind of just starting to dip their toe in the water with hiring new grads. And because of my paramedic background, I had the opportunity. I interviewed for two jobs, I remember. One farther away from home in a city and one close to home. And I ended up taking the job close to home and spent 18 years there. So,
Wow. So, Angelo, did you, just for the shifties, because we always talk about shifts in our career. So that was a shift right there. And it sounds like maybe your parents helped you with that shift a little bit. But when you worked in the ED, how long after working in the ED did you go back to school to get another degree? Did you stay in the ED department? Like, tell us a little bit about a couple other shifts along the way.
yeah, well, that's like another. I was never an academic growing up. I just wasn't. I didn't do real well in high school. I think my family kind of thought, maybe college was cut out for me, maybe it wasn't. And so I say that to say I end up going from the ED to the ICU. I'm an ICU nurse for about 2 years, and they posted an assistant manager job. They were reorganizing how nursing was administered, if you will. And so I have about 2 years experience. They post an assistant manager job, And I did what I often do when I apply for jobs, and I said, I'm going to apply, but I'm never going to get it. I only have 2 years experience. I'm in a level one trauma center. I probably have no business being in this role. And a long story short, I got the job on night shift. What was interesting about that job was the guy who used to be the assistant manager in that ICU and had decided to go back to a staff nurse position was on night shift too. And that can go many ways. It can be a complex relationship. I'll tell you, his name is Bill. He was a tremendous mentor for me on the night shift. And so um just tremendous amount of learning and just grace and very helpful in complex situations. Like if I was going to fail, he was right there to pick me up. And so because of that, because of him, and because of other people who were mentors on night shift, like I was able to grow quickly. And so before I knew it, I was moved to day shift to what they called an administrative team coordinator. And now I'm treading into waters where I need a bachelor's degree.
That's right.
And so, they basically said that this was the time where bachelor's prepared, like it was catching on, the whole you need 80%. And it was really like, hey, if you think you're going to want to go any further in nursing or nursing leadership, you need to go back to school. And so here I am again, kind of like making a deal, right? It's like, well, if you want to go further, you got to go back to school. So I went back to school, and got my bachelor's degree. That's how it happened. And shortly after I got my bachelor's degree, I was promoted to a nurse manager in the ICU.
And it's pretty amazing how every time you make that shift, it's a growing moment. It's a growing opportunity. What I'm kind of chuckling at, Angelo, is you said you never were an academic and you also have your doctorate. So that's kind of funny. But I totally get it. So did you get your bachelor's, master's, then DNP?
Yeah, I got my bachelor's, and then of course time evolves, and
Mhm.
now it's like, okay, well, if you want to be in leadership, now you need a master's degree.
Right.
Um, I intentionally did not get a master's degree in nursing. I will be very honest. I went and got an MBA. Again, a mentor swayed that decision. I was going to get a master's of science in organizational management. I was enrolled in the program, started my first class, and I was riding with a great mentor, Dr. Wood. We were in the car going to a hospital that was a distance away, and I was telling him I'm in my master's degree, and he said, "Get out of that program and get your MBA." And so we talked about it a little bit, and I listened to him and went and enrolled in the MBA program. Um, so my doctorate was really like, I think, proof to myself that I could do it, and something that I wanted to do. It was the first time that I think I enrolled in an academic program that I was like, I'm doing this for me.
Oh my gosh, that's great. And I think an MBA is so critical in nursing because we spend a lot of our time in the sciences, but the business piece, I mean, healthcare is big business. So I think that's really, really cool. So you've been a nurse for how many years now?
2024, which makes me feel old when I say that.
Oh, well,
Like
I'm
really,
31. So I mean, I'm not 31 years old, but I've been in healthcare for 31 years. I've been a nurse for 31 years.
yeah.
And today I think let's talk a little bit about the B word and what I've learned across when I travel across the country and talk about burnout, the B word. Some people are starting to get weird about that word. They find it's a very negative connotation. And I like to say, name it, claim it, tame it. So much like high blood pressure, you have blurred vision, you have a headache, you got to name it. And there's a name for it. After you figure it out and you claim it, it's high blood pressure. And you tame it by losing weight, eating healthy, not smoking, taking your medicine, whatever the case may be. Have you found in your leadership role most recently that people are starting to not like the word burnout?
Yes. And I think there's varying understandings and definitions and how people utilize the word um, and think about burnout. Like it to me, it's all evolving. 10, 15 years ago, we knew it as exhausted or something different. Now we're labeling it burnout. And I think sometimes maybe we're labeling things that aren't burnout. And so it's like we're still, I think, really trying to figure it out. For me, I think of I'm a diabetic. I'm an insulin dependent diabetic, and I've been since a young age. And for me, as I'm experiencing and learning burnout, I really have learned to manage it like I do my blood sugar. Sometimes your blood sugar is high and you have to take steps to mitigate it. And other times your blood sugar is like right where it needs to be. And you feel good. And, it's kind of like you're living, you don't even realize you're living with diabetes. And so, like for me, sometimes you can manage burnout to a state where you don't even realize you have burnout, but then it peaks up again, and you've got to start the management process. That's take the steps to manage on an ongoing basis.
Oh my gosh, that was so well said. Because, if you think about it, and I'm a self-professed burnout survivor. I have been burned out in my career more than once. And probably 20 years ago, the first time I experienced burnout, I didn't even know what it was. I just thought like I didn't like my role. I didn't like the unit I worked on. I was a newer med surg nurse, but all I did was I was cynical. I was critical. I was exhausted. I didn't want to go to work. I felt like, what's the use? But I didn't know it was called burnout. And
Yeah.
now that I know it's called burnout, you're exactly right. It just doesn't show up one day and 2 + 2 = 4, the problem solved, it's done. It is a balancing act, like high blood pressure, like congestive heart failure, like managing diabetes, as you mentioned. What are your thoughts, Angela? I'm just curious with your job. I know you have a big job with AMN and you work with a lot of nurse leaders from all over the country. Do you feel like burnout and well-being are starting to be put in the same bucket? And are they the same?
Well, I'll answer your last question first. I don't think they are the same. I think you can be well and burned out. And I think you can be not burned out and not well. Like, I think they're two very different things. I think about my career and I think about the times I was well or unwell. And I think about how was I burned out at those times. And I don't think, again, they go hand in hand. I think of wellness as like this big kind of all-encompassing state of how you are. How are you managing your chronic disease? How are you eating? What is the stressors in your life? Burnout for me is really about how you're managing the stress and circumstances you find yourself in on a repetitive basis. And how well can you manage that? Again, it's much like diabetes. Do you need a little more insulin? In other words, do you need a break? Do you need to remove yourself from the stressor? And how long do you need to do that for before you recover? I think, when we think specifically about nursing, I can remember, and I still hear it, and now it hits me different, where you hear nurse leaders or nurses say, I'm so exhausted, I work 70 hours a week, almost like a badge of honor.
Mhm.
And, if you want a surefire way to be unwell and burned out, you should keep doing that. Um, so I think we have to recalibrate. not only in nursing, but in healthcare, what badges we wear as, things we want to identify. And I don't think working long hours and being tired and exhausted is one we should be wearing. It's just, I think it's overdone at this point.
I would agree with that. And I know for me personally, I certainly wouldn't want to be in the hospital or have a loved one in the hospital. And the nurse that's taking care of me or my loved one is on their 58th hour of work for the week or whatever the case may be. That's
Yeah.
number one. Number two, it's a recipe for disaster. And I think it goes back to the very beginning of time. And I'll consider this my time as a nurse. When they would call me and say, Andrea, we're short staffed tomorrow. Will you come in and pick up a shift? And of course, I would say yes, because I didn't have boundaries. And I think sometimes healthcare professionals struggle with boundaries. And I self admit that I struggle with boundaries and I work on it. But if you are struggling with setting boundaries, you're setting yourself up for burnout. And, what I've learned because I have had burnout is it comes in waves. And you talked about that. It does come in waves. And also people think, well, I'm going to go on vacation for a week and my burnout's going to be gone.
Yeah.
Doesn't work that way either. I think there's a lot of opportunity in the healthcare space, but we're strictly talking about nursing, that we have got to help each other identify signs and symptoms of burnout and how we can mitigate it. And that's honestly, Angelo, why I work for SE Healthcare, because our entire platform is based on measuring burnout and helping clinicians and all people in healthcare to recognize signs and symptoms in themselves, them others, and then how to mitigate it. Because if not, we're not going to be the best. And our patients need the best.
Yeah, I agree. And I really think one of the ways, and I don't espouse to be a burnout expert. I just know what I feel. And I
Mhm.
know the experiences that I've had and lived through. And I wish two things, if I could go back in my career. And that was first, that I could better identify people who were burned out and needed an intervention. And I don't mean that like in an intense way, but just somebody to say to them, hey, I really can see the stress on your face. I really can see that this job is getting to you. How can we help? And I wish others would have identified that in me and said, hey, you're really getting crispy.
Yep.
Why don't you go over, why don't we pull you out of this environment for a little bit and give you a break, not because you've done something wrong, but because you've worked so hard to give everything you have and you just need a break.
And you know what, Angela, I always on the Shift podcast, I share some vulnerable moments in my career and some of my guests do as well. But I have this moment. I was working night shift and I remember driving to work in tears, and I just didn't want to go to work. I was exhausted. And I was on the weekend well program. And let me back up a little bit. I had been calling out a lot because I was unable to sleep. I was exhausted and I was having burnout, but I really didn't know what it was. But when I showed up at work, I was exhausted. I was cynical. I was critical. Um, I was probably not the best coworker and probably not the best nurse. And to your point, Angelo, if somebody would have pulled me aside and said, "Are you okay? What is different? There is something different. Do you want to talk about it?" I probably would have been able to go to EAP and get some help.
Yeah.
But what happened was my manager at the time took me off of the weekend wow program because I'd missed work and never once said, "Man, I've noticed you missed a lot of work. What's going on?" I'm not saying it's her fault. That's not my point. My
Yeah.
point is if we as healthcare leaders would be able to recognize the signs and symptoms in ourselves and others maybe I wouldn't have missed so much work.
Yeah.
And I'm not pointing the finger. And I've noticed that, I've seen coworkers that have complained, vented, shown the signs and symptoms of burnout, talked about how they have to drink wine to fall asleep. If I would have known that, maybe I could have helped with intervention for them as well. And I think I'm kind of on a campaign, not kind of, I'm on a campaign. We've got to help ourselves and our all of us in this great profession to say what's wrong. So, you're off a little bit. What's going on?
Yeah, I agree with you. And to your point, it's not pointing the finger. If there's any profession that is skilled and trained to manage burnout, it's nursing. And the reason I say that is because we are taught assessment skills, care planning, all of those things. Yet I don't know that we're taught the signs and symptoms of burnout in a way that we cognitively go, oh my God, that's burnout. Let's have a plan. We have a patient in the hospital, they have chest pain. We immediately go, let's assess for an MI. Let's start oxygen. Let's get nitro. We can run down that algorithm. Ask us how to identify and treat burnout. We don't have the algorithm yet. And I think our profession is positioned that when we have the algorithm, we'll do a really great job at identifying and managing it better, which quite honestly is what our profession needs. I think
Hmm.
it is a root cause in the nursing shortage that we've been experiencing, frankly, since like 1967. We keep hoping things are going to be different.
Right. No, I think that's so well said. So I'm going to ask you, Angela, to be very vulnerable. Do you have any one or more than one moment in your career where you were like, this is burnout and I need to shift because something's not working?
Oh yeah, absolutely. I will tell you, you know, when I worked as a paramedic, there's this I would like bravado about the experiences you live, the things you see, even as a critical care nurse, the deaths, the tolls, the injuries that people have. And, when I was in my 20s, not that you thought the injury was cool. That's not what I mean. You don't want anybody to be injured, but you thought the process of taking care of those individuals was cool. It's like, I want a good car accident if I'm going to have to do anything. I will tell you, when I got to my 40s, like the cumulative effect of those experiences, I can still see high school classmates laying in the middle of the road that I treated from a car accident. I can still see the people that I went into the house and they were dead from a gunshot wound. I can still see those images, and the effects that it has on me now are far different than it was then. Those cumulative experiences, those effects lead you to burnout. And you get to a point now where, like, if I walk in the room or I see those injuries, I don't process them and emotionally deal with them the same way I used to. They are much more emotionally raw for me. So yes. So, again, I can remember we had a structure fire and there was a person who was deceased in the fire, and the firemen pulled the person out, and you did everything you could to save the person. And after they ended up dying, but after they had what they called critical incident stress debriefing, and no one showed up because it wasn't cool to show up. And if you showed up, you weren't tough. You look back and you say, maybe I should have been a little less tough and showed up. So that's like the cumulative effect. I would say from a leadership standpoint, yeah, definitely been burned out. I mean, uh, and just needed a change. So I am grateful for the opportunity I have at AMN. It's given me different perspective, And to be out of that intensity of running a hospital, the operations and things has really done a world of good for my, like for my overall health and well-being from a burnout standpoint.
And I think thank you for sharing that. And I think it's important to recognize it in yourself, because sometimes you do have to remove yourself from that environment that isn't healthy for you.
Yeah.
And I was in a academic medical center, and I shifted careers over to SE healthcare on the software side, and I enjoy taking care of the people, taking care of the people, and
It,
I enjoy leading in a different way. I think in the absence of understanding what burnout looks like, sounds like, feels like, that's where the challenge is. And those are the people that man, do they burn out, and it hits hard sometimes.
yeah.
It really does.
Yeah,
Well,
absolutely.
Angelo, do you have any words of wisdom or any golden nuggets you want to share with the shifties on number one? You said one thing early on, and this has nothing to do with burnout, but it kind of does have something to do with burnout. You mentioned mentors. I believe mentors are critically important no matter where you are in your career journey. And I believe having a good mentor contributes to decreasing burnout. Do you have any words of wisdom, three takeaways for the shifties? And it can be about mentoring, it can be about burnout, leadership, whatever you want. But we always like to leave our shifties with three really great takeaways.
Yeah. So maybe the first one I would say is maybe controversial. I don't think our profession's that bad. In fact, I don't think it's bad at all. I think how we take care of ourselves, take care of each other in our profession is where we have a lot of opportunity. So I would say that to say we look at government organizations, we look at people outside of nursing and say, well, if I had another nurse on this shift, things would have been better. If I had XYZ, the nursing profession would be fixed. We owe it to ourselves in our profession to fix our profession for ourselves. So I think let's lean on each other, let's support each other, let's identify the process, the assessment tools, and the treatment for burnout, and let's like make a commitment together to fix it. Like that's the first thing because I am so grateful for my career and what it's taught me. And I really I feel bad when I hear nurses 2 years out of school going like I can't, this is I don't like this profession.
Mm.
So that's the first thing. Second of all, I would never be where I am without like a long list of mentors. Like just a huge list, so many that I couldn't name them in the next hour. And I'm grateful to have mentors. So you have got to find mentors. Even if you're the most experienced nurse out there, everybody needs a mentor, somebody to talk to. Um, and lastly, I think, you know, knowing when to say when and identifying when you need a change or a break. Those aren't bad things. There's no badge of honor for working 70 hours a week. Those are things I wish I would have done differently.
I'm just gonna piggyback on a couple things you said. Number one of the biggest reasons why I started the shift, and SE Healthcare loved the idea. And I ran it past Dr. Deb Zimmerman and Bonnie Barnes and Mark Barnes and a lot of other great leaders, and they loved the idea. The idea is exactly what you said in your number one takeaway. Our profession is not bad. Our profession is incredible.
Yeah,
Nurses make the impossible possible. And I am so grateful for my career. I love it. And part of what I want to do when I bring great guests on like you and others is to elevate our profession and remind people how important and vital our role is in society. So thank you for everything that you added, Angelo. I'm grateful for you. I'm grateful for your leadership. And shifties, I just want to say, remember, your shift makes a difference, so keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.